Thanks a million, dear professor. It's my pleasure to be with you today with the third step. So the third talk to me today will be just in the topic of my research. It will be about antibiotics in inguinal hernioplasty. So my name is Mikhail Fakhri. I'm assistant lecturer of operative surgery and clinical anatomy and PhD student also on general laparoscopic surgeon. My agenda will be introduction, some necessary question about this topic, and after that we'll go for conclusion. You may hear those words one day. They will schedule the operation as soon as operating room is available. So what is surgical operation? For those who don't know what is surgical operation, it's a medical procedure involving incision with instrument performed to repair damage or arrest damage in the living body. And what are the types of surgical operations? There are a lot of classifications for the types of surgical operation. Now I go for the type according to the urgency of the operation. We will go for urgent operation, which be a must or life-threatening operation, emergent operation, which must be within 6 to 12 hours, and elective or scheduled operation when we give the patient time to come with his investigations for us in the inpatient clinic. For any operation, we must consider preoperative management, operative management, and post-operative management. Preoperative management, for sure, it's before the operation, including all the investigations we will order from the patient and also the clinical assessment of the patient. Operative management will be just the set in the operation theater and also the anesthesiologist recommendation and the anesthesia set, and post-operative management including follow-up for the patient. Specifically, we will talk about those points in quick. What is inguinal hernioplasty, herniotomy, herniorrhaphy? What are the options of operation all over the world? What are the complications of this operation? And when we must use antibiotics, preoperatively, during the operation, or post-operatively? Is there any difference in using antibiotics during this operation according to the urgency of the operation? Also, is there any difference between using antibiotics according to the international guidelines and the clinical practice?
Не, они сказали, потом все коллеги зададут.
Okay. Please, colleague, who mute yourself. Also, what about the randomized clinical trials done in answering about this question? So first of all, inguinal hernioplasty. We must know that about 20 million patients and more all over the world every year are going for inguinal hernia repair. The many different approaches and treatment indications, also with a significant array of techniques for inguinal hernia repair, warrant to standardize care, minimize complication, and improve the results. So, what is the difference between herniorrhaphy, herniotomy, and hernioplasty? Herniorrhaphy is the classic one, the oldest type of the operation of hernia repair. It involves a surgeon making a long incision directly over the hernia, then using surgical tools to open the cut enough to access it. And herniotomy, an operation for the relief of irreducible hernia by cutting through the neck of the sac, while hernioplasty with the usage of mesh repair. In hernioplasty, instead of stitching the muscle opening shut, we cover it with a flat, sterile mesh, usually made of flexible plastics such as polypropylene or animal tissue. This operation had a lot of options all over the world. Classical option, it's open repair, traditional one, laparoscopic repair, modern technique, and in some countries, robotic hernia repair. There is no single standard for inguinal hernioplasty, and the choice of this method is based on the experience of the surgeon, technical capabilities, and the desires of the patient sometimes. The most commonly used methods for autoplasty or Shouldies repair, and among allogernioplasty-Liechtenstein repair. It's traditional and the golden standard all over the world in open hernia repair. Also, laparoscopic methods, the most commonly tab and tip. So, transabdominal peritoneal hernioplasty and total extraperitoneal hernioplasty. And this is what we have this long introduction. What are the complications of inguinal hernia repair? Complications after inguinal hernia repair are relatively common. The incidence is higher after emergency repair and recurrent hernia repairs compared with elective surgery. With the transition to tension-free repair, hernia recurrence is less frequent, while other complications such as post-herniorrhaphy, neuralgia have become more prominent nowadays. Complications that occur in the perioperative period include wound seroma, hematoma, urinary retention, bladder injury, and surgical incisional site infection. While complications that occur later on, so post-operatively, following hernia repair, include persistent growing pain and post-herniorrhaphy neuralgia, testicular complication, deep incisional and mesh infection, recurrent hernia also, and mesh migration with erosion. So the possibility of infection preoperatively and postoperatively still very high. Urgent and emergency procedures are associated with higher complication rates compared with elective repairs, as the surgical site infection and mesh infection are from the complication of hernia repair, so we need to use antibiotics. But when we must use antibiotics, shall we use them preoperatively? Shall we use them during the operation or postoperatively? And if we would like to use them, shall we use just a single dose and when and or treatment course? When we must use antibiotics, there are a lot of clinical trials all over the world which assure the prophylactic antibiotics in open mesh repair like the laparoscopic inguinal hernia repair. When we'll talk about the prophylactic antibiotics in open mesh repair of inguinal hernia, we will see that all over the world they are not using in clean surgery any antibiotic, but the recommendation and guidelines go through that we must use in mesh repair according to not non-mesh repair or tension-free repair. Even though the reported incidence of wound infection varies to 9% and sometimes till 15%, as more and more surgeries are done as day case surgeries, many of these infections are often recognized first in the outpatient setup or outpatient clinic after discharging the patient from the hospital. The most common organism isolated was Staphylococcus aureus, which forms a part of normal skin flora. It is a well-known fact that increased preoperative hospital stay increased the risk of colonization with resistant bacteria. Cefazolin, in a lot of literature, is the antibiotic of choice and also in a lot of hospitals all over the world. How we can use them? 1 gram of Cefazolin must be given intravenously at the time of induction of anesthesia, so in the operative period. Also, prophylaxis prescribing patterns in laparoscopic inguinal hernia repair give us the ability that where evidence suggests antibiotic prophylaxis not necessary, may and many surgeons still use them routinely. Single dose of antibiotics during the operation induction. The use of antibiotic prophylaxis during hernia repairs with mesh may be more important than in non-mesh repairs because of the consequences of graft infection. Surveys conducted among surgeons have reported that about half of them use antimicrobial prophylaxis for hernia repair, whatever the operation is clean or contaminated or contaminated. So, is there any difference in using antibiotics during this operation according to the urgency of the operation? For sure, yes. If prophylaxis antibiotics has not a great role in some literature in low risk rate patient, but it has a great role in emergency complicated inguinal hernia repair. So in case of Amyands hernia, for example, the hernia in which appendix or inflamed appendix, a part of it, is essentially used preoperatively, during operation, and postoperatively also as course of treatment. Irreducible hernia as a cause of intestinal obstruction needs also to have follow-up and give the patient a course of treatment, which will include also antibiotics. Complicated hernias which need urgent repair without mesh also are in need. So, is there any difference between using antibiotics according to international guidelines and the clinical practice? The Association of Surgeons of Great Britain, also the European Hernia Society guidelines with the National Nosocomial Infection Surveillance assuring a lot of things from them, the system index which identifies the following risk factors for surgical site infection. Surgical site with a wound classification of either contaminated or dirty infected must take antibiotic. Also an operation lasting more than 2 hours or more than 75% of the time allocated for the operation must go for antibiotics. The patient's American Society for Anesthesiologists score of more than 3 must also go for antibiotics. A long duration of the operation and drainage are listed as procedure-related factors, and also comorbidities such as diabetes mellitus, rheumatoid arthritis, obesity are also included among the risk factors. Surgeons still using prophylaxis antibiotics as a single dose during the induction for elective surgery. Also, they still use treatment course of antibiotic for 7 days during the emergency complicated hernias. And also, when will we go for reviews of studies according to literature, we will find a lot of them. I choose just one from the study, prospective and randomized trial, preferably double-blind one, which are of the greatest value. And 12 such studies have been conducted over the past 15 years. 3 of them demonstrated the efficacy of prophylaxis in the prevention of surgical site infection, while 9 of them recommended against its routine use. This is a trial study in which you will see the sample size and the antibiotic we are using, or those people who used in Spain, Turkey, Netherlands, also Philippines, Greek, India, and Egypt, Japan, and the percentage of infection which were related post-operatively. This is the explanation for what I just said. In conclusion, using antibiotics in the practice of inguinal hernia repair still essential to predict the surgical site infection. The single dose of antibiotics as induction is preferable in practice despite some literature studies. Using antibiotics in complicated inguinal hernia or in those patients with high risk for mesh infection and surgical site infection as a treatment course of 7 days reduces the post-operative complication. Thanks a million. Don't hesitate to ask me any further question. If you would like to ask by mail, I will be very ready.